guys, so today's not really going to be a vlog, but kind of is. We have Dr. Gina and Nicole going to be doing some things today. We got these two guys. I haven't seen these guys yet. Hi. Hi. Hi, Star. Wanted to come out here and say hi to the horses for you guys today. And then we got Tux over there. Hi, sweet girl.
So this is one of the little guys that we intook yesterday. He had a little bit of a fever yesterday, so we kept him by himself overnight so that we could run him back through the chute this morning and just do a double check on him. His temperature has come down, so that's really good. So hopefully he'll be able to go out later today with the rest of the guys. Right now, Dr. Gina and Emily are getting ready to do 2 cat neuters on some cats that came in yesterday. And then we'll be looking at one of the goats that's been here. He's got a little bit of a limp, it looks like, this morning. So we're gonna possibly do some x-rays and see what's going on with that leg.
So we have this horse out here in the 10 acre that's not feeling too well. So Dr. Gina is gonna come up here and they're gonna take a look at him, but we're not sure. Maybe colic, we're not sure. But he's not feeling too good. Aw. Buddy.
Haley also noted he's like very swollen in his face, and I fed him treats and doesn't have very much motivation to chew anything.
His lymph nodes kind of hard, but they're not super enlarged.
He had conjunctivitis, I wiped it off.
I mean, he's got some movement. He's not locked up. So I don't know about bad dental. Okay. We were worried about right here. He seemed to have pain in his neck.
He's a little bit reactive.
So he doesn't really want to really stiffen his neck. He could just do a chiropractic adjustment, but probably don't like
Did you get beat up by a woman?
He doesn't really have good flexibility in his neck. We could try carrot stretches and see if he'll do it on his own, but yeah, his whole vertebra is stiff.
We're up here in the Q intake barn with Red. They came up to recheck one of our little colts that we had up yesterday that had a really big fever, and Caitlyn and Nicole noticed that he was down in the pasture in the 10 acre, and they went out to get him up, and he got up and then immediately laid back down. He wasn't acting colicky per se, like kicking, rolling, thrashing, or anything like that, but the fact that he just laid immediately back down was abnormal. And so Nicole came to get me to come up here and look at him, and Caitlyn got him into the intake barn. So I came up, scanned him. He's got a fever of 104. His heart rate's 48, so that's not super high, but that's higher normal. We like it to be like 44 or below. His respiratory rate's okay. I didn't hear anything super abnormal on his lungs. He's got soft and decreased GI sounds, but they're still present. He's got some diarrhea, so I'm surprised they're so soft with diarrhea. I gave him some pain management. I gave him some xylazine and some flunixameglumine, which is an NSAID. That'll help with the fever and also with if he's painful anywhere. And so we're going to try and get him down to the vet barn to intake him. The only other findings that might be significant is that his submandibular lymph nodes are starting to feel enlarged. They can be enlarged for several reasons, mostly infection or inflammation from different kind of bacterial or viral problems. So we're going to see about getting him down to the vet barn to monitor him. I'd like to run some blood work and then possibly pop an ultrasound on him. And if he's not being able to be controlled medically with pain management, we might either have to put the NG tube up his nose and check and see if he has reflux, or put it via rectum and give him fluids if he's dehydrated. I can also palpate via rectum to see if I can feel any kind of impactions or anything like that, or volvulus, something that would cause colic, but he doesn't seem colicky to me. He seems like his pain is from something else. So, got to further work him up, but hopefully we can get him down to the barn soon and keep an eye on him.
Gordon's found him a little spot.
You're probably at about a 4 for your FAMACHA score. So if you look at their bottom eyelid and hold it down and look at it, you see how pink it is?
Oh yeah.
Really, really red is a 5, which is fine. The paler it gets, the more anemic they are. If it's 3, between 1 and 3, 3 is like questionable treatment. 2 and 1, you have to treat them. It means that they have a high worm burden that's causing them to be anemic. Mostly homuncus or something like that is what you'd think of, which is, I think, what the barber pole worm is. I think homuncus. When they ask for, it takes away his tax rate, and that's they almost have room. I know, it's probably really weird. Whoever did my taxes last year did them online. Yeah, that needs some trimming, but the toe on that side needs some trimming. You have an even wear right there. That one's a little bit. So he's got some uneven wear. This is Blackie. They've noticed this morning and yesterday that he just seemed kind of off in some of his limbs. He's unfortunately been the victim of his bigger brother ramming him a lot, and he's been picked on. So we got him in and looked at him, and he has some mild heat elevation in his left forelimb and left hind limb. His toes do need to be trimmed, so whether or not it's related to inflammation and angering of that limb based on changing of ambulation based on that, I would like to get him trimmed and see if that helps. His heart rate was a little elevated, he's nervous, but his heart otherwise sounded fine, his lungs sounded fine. He's over-conditioned, so he's a little overweight, and overweight can exacerbate if there's any kind of arthritis or something like that, because it does create negative or inflammatory cascades. So I would like to try and reduce some of that weight on him. I don't think he's got anything major like fractures or anything that we need to be worried about. So we're just gonna separate him from his mom and his brother who have been picking on him, reduce his feed intake a little bit, just make sure he has some good quality grass and some goat feed, but partition it so it's the right amount for his calorie intake. And then recheck him later and see how he's doing. But I'd really like just to get those feet trimmed up and see if that helps him a lot more. Since he is a farm animal and a meat goat in particular, that type of breed, a boar goat is a meat goat, we have to be really careful veterinary-wise what we can give them, because there are regulations that prevent us from giving certain medications to farm animals, legally speaking. So I have to look up and see what we can do pain management-wise for him if the trimming doesn't reduce his pain. So that'll be a fun adventure for goats. But he's really cute.
Stop.
He's a big boy. He says hi. Yeah, like I can't get my hand very far in because there's a bunch of hard feces
Really
right
dry.
there. Yeah, which is weird considering he had all that diarrhea.
So earlier today, the vet team found Red down in the 10-acre. After a brief vet exam, Dr. Gina decided to bring him down here. At that time, we didn't think he was colicking, but we couldn't quite pinpoint what was going on. We put him in a stall in our vet barn, and Dr. Gina just went out to briefly check on him, and he was rolling. He's very uncomfortable. He got pain management a few hours ago, and it's starting to wear off now, and he is in more pain than he was earlier today. So Dr. Gina first stuck a tube in his nose to see if he had a blockage, or anything. And then she just went rectally to see if he had a blockage. And he does have some dry poop. Dr. Gina will tell you more about that. So next course of action, we're just kind of doing all the stops until we can somehow help him and kind of cross all the bridges. But Dr. Gina is going to pass a tube rectally and give him rectal fluids. He is a little bit dehydrated, so that'll help kind of perk him up. We're gonna have to do further diagnostics, but for now, we're giving him lots of cuddles, and he's doing very good for his treatments.
Yeah, that same material isn't really going anywhere. Have you been eating rocks? Or do you have masses? There's like a little loop of duodenum right there. And it's hypermodal. So something between duodenum, or sorry, jejunum. Small intestine that plops in right there. I guess it's over there now. And that's hypermodal. I'm going to attempt to do an abdominocentesis, which is a abdominal tap, to see if he's got changes in his peritoneal fluid. If there is an increase in total protein, if there is an increase in other type of cells, or if there is a change in the color, that could all tell me different things about what's going on internally. If you tap it and you find fecal material in that peritoneal fluid, then we know he has a rupture, and that's automatic game over. Once that happens in horses, it's bad news bears. I don't think we're that advanced yet, but I would like to just see what's going on internally with that. It's just another diagnostic tool to see how his GI is responding inside of his abdomen. At first, when I first saw him this morning, sometimes when we say horses are colicking, that just usually means they have pain in their abdomen somewhere. A lot of people automatically think it means there's a GI problem, but sometimes if they have like a urinary calculi or bladder stone, something like that can cause colic pain. If they have something respiratory-wise that can cause colic pain, it can be referred from somewhere else. So I wasn't exactly just jumping to that he had like an impaction or anything, because he was passing feces up in quarantine. But once I put my hand up into his rectum and felt that I couldn't pass it any further, and also usually the rectum is a straight in, and his was deviated to the left, and usually that means that there is a impaction deviating the colon off to the side. So I think he's got an impaction colic in his colon. We put some fluids via his rectum to hopefully break up that really hard fecal material so he can hopefully pass it. He's passed some, but his rectum was really irritated, so I didn't want to keep putting my hand in there. Hopefully everything will calm down and I can recheck it. Also on ultrasound, we found hypermotility in some areas, and then we found like no motility at all. So GI stasis, which is a poor prognostic indicator. So hopefully we can get his GI moving and everything, but I just want to make sure everything is looking good in his peritoneal fluid. There it is. You want a tube? Yeah. There you go. It's kind of cloudy. Sorry, buddy. Try not to put it too far in because I don't want to actually get intestines. There you go. I also have an EDT if you want.
That is beautiful.
Okay. All right, buddy. Good job. Very good boy. This is some of the drops that came out of his abdominocentesis tap that happened to come onto my glove, and there's just like little flecks of stuff that looks kind of like abdominal content or GI contents. So that's not looking great.
It does appear that there are small flecks of abdominal content or of GI contents in the fluid sample that we took. There is a chance that if the GI is really distended, that even if you go in just barely a little bit, you could actually end up doing an enterocentesis into the GI tract as opposed to just an abdominocentesis. So that is a chance that we got ingesta from his GI tract instead of a true sample from his abdominal cavity. We could give him some antibiotics and recheck him in a little bit and see if he still is able to have his pain managed, or if he's not able to be managed, then he would be a surgical candidate, and that is a surgery that we don't do here. He'd have to go to a referral hospital, and that even going through colic surgery, there are a lot of poor prognostic indicators that happen, and the recovery is rough, and some horses don't even make it through the recovery. So that would be something we'd have to talk about as a team if we think he would be a good candidate for that, and if it's something that we could do for him.
More liquid. Oh, it's like right there on you? Oh, it's so dry. He's straining very hard. You're doing it. It's a boy. Good job, buddy.
We'll see if he'll let me put this hand up his bum again. Want me to try again, big guy? Sorry, I know your butt's probably like so painful. All right, let me get it back in place. What is that? Is that just your intestines folding over on themselves? There's like a lump, a soft tissuey lump I can feel to the left. Yeah. You need to come out of there, girl. There you go. All right, let's see what you do. If you want to pace around and get that poop out, that would be fantastic. So we just put Red out in his stall just to see what he would do. Hopefully that he would walk around and hopefully help some of that GI stimulation happen. He urinated immediately and then started eating some hay, so that helps me know that he's at least comfortable enough to be interested in going and eating and not just laying down. So we're gonna leave him in the stall overnight. Hopefully he'll be perky bright in the morning. We gave him some IV fluids. We gave him 2 rounds of rectal fluids. We did the abdominocentesis, but there is a chance that it was an enterocentesis instead, because he doesn't clinically look like a horse that had a ruptured GI. So his blood work looked pretty okay. Nothing super alarming about it. His heart rate is staying in the 40s. Other than that, he just looks physically uncomfortable and he's trying to go to the bathroom. So hopefully that extra dose of fluids will help break that up and help him get it out. But movement is really good. So that helps stimulate GI movement. So we're hoping in the morning we'll see a nice, bright, bubbly red. So hopefully he'll pass and he'll be fine. So for a follow-up on Red's case, after we gave him oral and rectal fluids and some pain management that was a little bit stronger than just the initial xylazine, he did end up passing his impaction, and he had several good piles of fecal material in his stall. So we had cleared the impaction, which was great, but there were still some changes from intake on radiographs that when we were discussing him with his colic episode, we also revisited his radiographs and his limited mobility in his cervical spine. So he can't bend his head side to side like he should. He just kind of like cranes like this. And he's also really neurologic in the hind. So he kind of keeps his legs way out and he sways when he walks. So discussing all of that and his colic episode, unfortunately, upper management and the vet team kind of came to the conclusion that he was really painful, and the changes on his radiographs were true. Because sometimes when you're looking at them in the field, you're worried that it might just be like something you're seeing, and when you get it into the equipment in here and look at it on the computer, it looks different, but it was the same, and you could see it on both views. So he had some true pathologic changes in his cranial cervical spine and his skull, his caudal skull. So given those signs and then how off he was in the hind, the last act of kindness was decided for him, unfortunately, even though we got him through his impaction cock episode. But going into the winter and worrying about horses colicking over and over again and things like that, and that he was so painful, even with just, I mean, it was a pretty big impaction, but it wasn't so significant that it was like causing a volvulus or any kind of thing like that. But he was just really hard to manage his pain with that. So given how painful his neck is, we were really worried about him. So it's not the update I was hoping to give, but yeah, the last act of kindness was what was decided.